Students, what is the dream? What is the success? What is the actual way to achieve your success? So, here is one beautiful motivational quote for you all. The actual way, the actual path that is very much necessary to reach your success, dreams, and goals is that is your work. Students, dreams doesn't work unless you work for that. So you have to work for your dream. You have to be dedicated. You have to maintain the consistency. You have to be purposeful. You have to be very much dedicated towards your the goal. So that's the way actually you have to reach your dreams. So when your dedication, consistency, hard works, and opportunities meets together, that is the actual way, that is the actual point where you become success. So be prepared, be strong yourself, and be ready to grab the opportunities. There are many opportunities in our nursing field where the students are lacking to grab the opportunities, and the many government vacancies are going waste. So students, the actually if you are working hard, if you are maintaining the consistency, definitely 200 percentage you become success in upcoming time. So no need to worry, no need to be in depression. Be strong, be workful, okay, be productive. So that is the actual way to achieve your success. I'm Mr. Nagraj, your NORCET mentor and AIMS nursing officer, dealing the today's very important topic of the Glasgow Coma scale and our favorite AIMS topic, that is the Glasgow Coma scale with P. And what is the use of AVPU score? Actually, I am going to talk on this topic today, the very important topic, students. So, in previously only we have told to many students that this NORCET, the Glasgow Coma scale, P is going to ask because it's already updated in 2018. So, until the NORCET not show any interest to ask this question. So, whatever we told to our students, so in previous prelims exam, they have asked regarding this question, Glasgow, comma, scale plus P. So, how you have to calculate that one? How you have to deal with that question? What kind of question the examiner arises in that? So, I am going to describe each and every point regarding the Glasgow comma scale and Glasgow comma scale P versus our AVPU score, where you have to use the Glasgow comma scale, where you have to use our AVPU score. Very important, you have to understand, students. I am going to discuss the scenario based question, clinical question, and the actual question the examiner want to ask in your exams. So without wasting time, we will move to our class. That is the here is the first today's very important question, 5-star question for your exams. Okay, let me read the question, students. Question is like this: a client in emergency, on examination, he opens his eyes only to the painful stimuli. Patient is opening his eye only to the painful stimuli. Okay, let me change my pen color. So here is okay. The patient is or the client is opening his eyes only to the painful stimuli. Okay, and he says inappropriate words and he moves his limbs on commands, and both pupils are unresponsive to the light. Very important word which changing your entire question and which changing your complete answer. Here is the question like this. So calculate the Glasgow comma scale and P. Yes, tell me the answer. Here you have to know what is Glasgow Coma scale, the use of Glasgow Coma scale, and the scoring system of the Glasgow Coma scale, which is very much necessary to answer this question. Along with that, you have to know what is P. If you don't know what is P, your answer is wrong. Here is the complete explanation, and we will discuss each and every question which arises out of Glasgow comma scale. Okay, so be connected with complete video. If you are watching this complete video means you will never ever regret on this question in your future life. Okay, so please do watch the video completely. I am discussing each and every point which comes on the Glasgow comma scale and Glasgow comma scale P and AVP score. Okay, let me explain regarding this question. Okay, here is the question comes like this. On examination, opens his eyes to only painful stimuli. Inappropriate sound moves on the command, and pupils are unresponsive to the light. We have to calculate Glasgow coma scale to speed. Let me explain this first. What is the history of the Glasgow coma scale? In the 1974, Janet and Tisdale only they have described the word Glasgow Coma scale in the city of Glasgow in US. So because of that, the word come Glasgow here. Okay, Glasgow is the city. So on that city name, they have given the word Glasgow Coma scale in the year of 1974. Who is the founder of the Glasgow Coma scale? Wait, I will explain that scoring system also at the end of this video. You will knowing that how you have to solve that question. Okay, so you have to know this one also. Very simple question. Who is the founder of the Glasgow Common Scale? He is the Janet and Tisdale. The year of discovery is 1974. Okay, in the year of 2018 only the Glasgow Coma scale updated into the Glasgow Coma scale P. So in the your last previous NORCET prelims exam, they have asked the question related to the Glasgow Coma scale P. Is it right? Yes. What is P stands for here? We know GCS means the Glasgow Coma scale. We are having the three main components in that: eye opening response, verbal response, and motor response. What is the P? Yes, P is none other than pupil response to or pupil reaction to light. How our pupils is responding to light. On that, we will give three scoring. That three scoring we will discuss in our Glasgow Coma scale P session in this class only. Okay, be connected. Here is the history of this Glasgow Coma scale. Founder of the Glasgow Coma scale is the Janet and Tisdale in the year of 1974 and updated in the 2018 by the Brandon and Maria in the year of 2018. So the new word came Glasgow Coma scale and P. Okay, here P stands for pupil reaction to the light. Okay, so let me tell the uses of the Glasgow Coma scale and Glasgow Coma scale P. Whether it is used separately, no, the purpose of both scale is similar. Glasgow Coma scale P is the updated version of the GCS. Okay, so what is the use? It is used to assess the lock. What is the lock? Lock is the level of consciousness in emergency patient. No, in not emergency patient. Glasgow's coma scale we will not use in emergency patient. We will use the AVPU score in patient who comes in the emergency department or emergency room. So when then at what time we will use the Glasgow coma scale? We use the Glasgow coma scale routinely in the patient when admitted in the ICU with a head injury, with increased intracranial pressure, and patient on the hypnosedatives, overdose, and in all neurological dysfunctions, because it having the three components, each component again having the 4, 5, 6 components. So it's time consuming process to assess the entire Glasgow coma scale in the emergency department. Because of that, the neurologist updated one more modified version of the Glasgow coma scale, that is the our very simple AVPU scoring. Okay, where we will use this AVPU scoring in the emergency department when the patients come with a head injury, when the patients come with the altered level of the consciousness. So in order to assess the level of the consciousness of the patient, we will use in emergency, we will use the AVPU score. In routine, for the patient admitted in the ICU or in the Words we will assess the like this in the routinely. Okay, so for craniotomy patients, also head injury patients, also we will use the Glasgow Coma scale. Here is the very important difference. You have to know that the Glasgow Coma scale and GCSP is similar, so used for the only one purpose, that is to assess the level of consciousness. And AVP is used in the patient with emergency. Okay, patient in the emergency department. Okay, that's the very important difference you have to know. So GCS is not used in the emergency, AVPU is used in the emergency. Okay, here is the clear explanation about it. Okay, so here is the component of your GCS, very important. What is the minimum score? What is the maximum score? What are the three components which all are comes under the Glasgow Coma scale? Okay, we will discuss those three components in detail. After that, we will go for GCSP. Okay, and at the end of the conclusion, we will deal with the GCSP, how we will calculate the GCSP. Okay, our first components of the Glasgow Coma scale is like this. In order to remember that one, you have to remember EVM. E means eye response, V means verbal response, M means motor response. Okay, very easy. We are having the three components: eye response, verbal response, motor response. If the patient is having no response, means we will give the minimum score. If the patient is having the better response, so we will give the maximum score. Okay, so for eye response, if the patient is not responding with eye, we will give the minimum score 1, maximum score 4 for the eye response. Okay, for verbal response, minimum score is again 1 and the maximum score is 5. For the motor response, minimum score is 1 and maximum score is 6. Okay. What is the total number of the minimum Glasgow Coma scale? Here is the 1 plus 1 plus 1, that's the 3. 3 is our minimum GCS score. Okay. And maximum GCS score is 4 plus 5 plus 6 is 15. Okay. 15 is our maximum GCS score. Very important. What is the minimum GCS score? Minimum GCS score is the 3, maximum GCS score is the 15. Okay, very important. The one liners comes here. Okay, the examiner may ask like this also: what is the minimum eye response score? That's the 1. Maximum eye response score, that is the 4. Verbal is 1 5, motor is 1 6. Very important. So if the examiner asking total scores, like what is the minimum GCS score is the 3, what is the maximum GCS score is the 15. Okay, we will deal with this first components first. That is the eye response. I have explained with very important tricks here. We have one sports channel with the name called ESPN. Okay, Sony ESPN Sports Channel. This one. Okay, so to know the eye response, I'm using these tricks. So okay, so E stands for eye opens spontaneously. If the patient is opening the eye spontaneously like this, okay, we will give the maximum score. That is the better score 4. Okay, if patient is responding to speech only. For example, patient name is Mr. Mahesh. I am calling patient Mr. Mahesh. Mr. Mahesh. I am calling like this. So he is opening his eyes, means we have to give the 3 score. Okay. So when I pinch to the Mahesh to the painful stimuli, he is responding. He is opening his eye to painful stimuli, means we will do the score with 2. Okay. N stands for no response. That is the minimum score 1. So maximum eye response score is 4. Okay. Minimum eye response score is 1. The total eye response score is 4 from 1 to 4. Very important tricks. That is the ESPN. Eye opens spontaneously is 4. Speech 3. For pain 2. And no response 1 score. Okay. Very important. Let me go for the. Okay. Here one like clinical questions comes. If the patient comes with a eye injury, if someone hit the patient to the eye or the head injury, which also involves the eye injury, at that point of time, what you will record? Patient, if he able to open the eye, but due to the pain, he is not opening the eye. At that point of the time, we will mention not recordable, or we will mention the capital C, that is closed eye. Okay, very important. So rest two components, that is the verbal and motor components, we will count and mention in our nurses notes, and this eye response we will mention the capital C or not recorded. Very important. Clinical scenario based question. Okay, if the patient comes with any kind of the eye problem, like direct eye injuries, like head injury which involving the eye, at that point of the time, the patient is unable to open the eye due to the pain of the eye, means we will mention that's not recordable or closed eyes. Okay, here is the very important. You have to remember. Okay, let me move for the verbal response. Okay, here is our tricks. Our country win. Unfortunately, we are unable to win the World Cup. Still, we have considered that our country win because of the great performance of our players. Okay, here is our tricks for the verbal response. The tricks comes like this: our country win. Okay, here is the very important tricks. Okay, so O stands for O here, oriented. If the patient is oriented, I am asking the patient, Mr. Mahesh, what is the today's date? He is telling the today's date exactly, and asking I am asking the patient in which floor of the hospital you are staying. He is telling exactly I am in first floor, ground floor, second floor, like this. And I am asking the patient what is the time. He is oriented to the time, place, person, everything, means we will give the better best score, that is the maximum score for the verbal response is 5. Okay, if the patient is confused, I'm asking to the patient, what is the time today? He is confused. He is telling, after watching the watch also, he is telling is 2, 3, 1, like this. Means he is in confused. Means we'll give the score 4. He is saying inappropriate word. I'm asking his name. What is your name? He is not telling as Mr. Mesh. He is telling like Narendra Modi, like this. Inappropriately, he is telling the words. Words he is telling means that is inappropriately. We give the score 3. Okay. He is using the incoherent sound. What is the incoherent sound? I am asking Mr. Mahesh. I am telling Mr. Mahesh. He is telling oh, like this. Incoherent sound. That is number 2. Okay. So no response means again we will give them, that is the least score 1. Okay. Here is the verbal response score. Maximum is 5. Minimum is 1. Okay. Very important. So this is our verbal response score. Here the examiner asks with the practical or the scenario based question. If the patient on the tracheostomy tube, if the patient already intubated with E2 or on ventilation, so at that point of the time, how you will record the verbal response of that particular patient? Simply, we will mention their verbal response is not recordable, or we will mention the capital T if the patient on tracheostomy tube. Okay, very important. You have to consider here if the patient on the tracheostomy tube or if the patient on ventilation. So we are unable to assess the verbal response of the patient because patient we have interrupted his speech flow. So at that point of the time, we will write not recordable. And rest two components like eye opening and motor response, we will record in the response. Okay. I hope you have clear with the verbal response. Okay. Let me move for the next component, that is very important component, that our motor response. Okay. So what is the motor response? How you have to remember motor response? Here is one tricks for that also. Can't live without fan. Okay, can't live without fan. The patient, after the World Cup loss, so with the depressions, our cricketers telling like fans are very much important for us. So we can't live without fan, like that. Okay, so for easy remembering, you have to remember this one. Like, cricketers are telling can't live without fan. Okay, here is the word sees. Can't means C L without fan. Okay, very important. We have to remember. So, how we will assess the motor response of the patient? We are giving commands to the patient like Mr. Mahesh, please raise your hand. The Mahesh is raising his hands. Means he is obeying our commands. Whatever the commands we are giving as a healthcare provider, he is obeying our commands. Means he is following our commands. Means his motor response is very good. So we will give the better best score. The better best maximum score is of the motor response is 6. Okay. The patient is localizing the pain. So we are pinching one side, is localizing the pain, means we will give the best score, that is the 5. If the patient is withdrawing to pain, means we will give 4. The patient is maintaining the abnormal flexion. Okay, abnormal flexion is there, means like this. See, elbow flexed, wrist flexed, and like this. This is called decorticate position or abnormal flexion. It occurs due to the damage to the our cerebral cortex. Very important. So abnormal flexion at that point of the time you will give the score like 3. Okay, and A stands for abnormal extension. Patient is extended, so that is called decerebrated. So decerebrate occurs due to the damage to the brainstem. Okay, so we give the score that is 2. The patient is unable to move. There is no any motor response by the patient. We will give the minimum score as 1. Okay, this is our Glasgow Coma scale. So in motor response, so we give the minimum score as again 1 and the maximum score as 6. Okay, very important to remember. I have told all 3 components with tricks. You have to note in your notebook. So after studying this Glasgow Coma scale, no need to refer any book. Just go and directly attempt the question which are given in your NCLEX, PRADO, Target High, whatever the guide using for the question practice. Okay, 100% your answer is going to right there. So here is the explanation for this. So let me move for the today's question, main answer. NORCET favorite question. Okay, that is the Glasgow Coma scale P. Okay, what is P stands for? P stands for pupil reaction to light. So here is our eye with pupil. We are assessing the pupil reaction by facing our on torch on the pupil. If the pupils, both side pupils, okay, unresponsive to the light, we will give the score -2. Very important. One side pupil is responsive, another side is unresponsive, means we will give the -1. Both pupils are unresponsive, means -2. One is responsive, another one is not responsive, means -1. If both are responsive to the light, when we put the light on the pupils, which is constricting, when we remove a light from the pupils, which is dilating, means the both pupils are responsive to the light. So we will give the score 0. Very important to understand, because whatever the total score comes in our Glasgow Coma scale, we have to substitute. Okay, we have to substitute, we have to negative, we have to remove those GCS score minus GCS P. Okay, very important. I will explain in the question. So how to calculate that? Okay, let me take that question here down. So we have studied the how you have to calculate our GCS P. Okay, this is how we have understood the question. So let me deal with this question. A client in emergency on examination opening his eyes only to the painful stimuli. Okay, eye response is like this. Let me write here. Eye response is only to the painful stimuli. If the patient is opening eyes spontaneously, means we will give the 4 better score. To speech means we will give the score that is 3, and for the painful stimuli we will give the score 2. For high response, we are giving a 2 because the patient is only responding to the painful stimuli. Okay. So next is verbal. Okay. Next is verbal. He says inappropriate words. Patient is saying inappropriate words. Again, apply the tricks. That is, our country win. Okay. So O is the oriented, C is the confusion, W is the yes words inappropriate. Means 5, 4, 3. We'll give the 3 score here because here you have to see because the patient is verbal response to word inappropriate word is using. So 3 score we will give here. Okay, 3 score. 1 minute, please. Here you will use the 3 score. Okay, so verbal is 3. Okay, and let me come for the motor one. Okay, motor one. So moves his limbs on the commands and okay, motor one is moves his limbs on commands. Okay, on commands he is moving his limbs. Means I am telling the to Mr. Mahesh, please raise your hand. He is raising the hand. That's the best score. We are giving the 6. Okay, here I have mentioned he obeys the commands means we will give the 6 score. That is the maximum score. Okay, so our total Glasgow Coma scale is 11 here. Okay, 6 plus 3 is 9, 9 plus 2 is 11. But what the examiner is asking exactly here, he is asking the calculate the Glasgow Coma scale P. And the last word he given here, pupils are unresponsive to the light. That is, both pupils are unresponsive to the light. So what I have told here, if the both pupils are unresponsive to the light, what we will give here? The score. Here is the score. If the both pupils are unresponsive to the light means that is -2. Okay. So here is the our P goes to -2. So how we will calculate our Glasgow Coma scale like this? How to calculate means our Glasgow Coma scale comes to like GCS. We have calculated it is a 11. Okay, plus P. P is our both people's and response to the light. That is our -2. Okay, P is -2. Yes, P is -2. So what is our actual Glasgow Coma scale? That is the 11. Okay, let me write it again. See how we will calculate this one. Our Glasgow Coma scale plus P will calculate. Okay, our Glasgow Coma scale come like this 11 and plus our people response is both peoples are unresponsive, that is -2. Okay, 11 plus or minus plus into minus is minus. Okay, 11 minus 2 is the 9. Here is our answer for this question. Yes, students, did you understood this question? It's very important. Our Glasgow Coma scale plus P means whatever the Glasgow Coma scale counts comes here. So in that we have to substitute the things which is given as a P. Okay, if the both pupils are response to light means yes, we'll give Glasgow Coma scale plus 0 means our GCS P goes the same answer. And if one pupil is responsive, another one is not responsive means whatever the Glasgow Coma scale comes among that will minus 1. Okay, both are unresponsive means the -2 we will do on in the GCS score. So that gives our final answer. Okay, so here is the answer for this question. That is the answer is option A. Okay, that is the answer is 9. That is the option A, 9. Okay, hope you understood this question and what is the Glasgow Coma scale, how you apply our knowledge to deal with this question. Okay, very importantly, in this question, in this discussion, I have not only discussed regarding only in this question, I have discussed those points which are very necessary. What are how much the minimum score, GCS score, what is the maximum GCS score, who is the founder, and each and every components of the GCS score I have explained in detail. Okay, so Here it comes the GCS P score. If the examiner is asking the one liner like this, what is the total maximum GCS score? Maximum GCS score means I told that is the Glasgow, comma, scale plus P. Okay. Here is the Glasgow, comma, scale. Maximum is the 15 plus P is, or both peoples are response means 0. Okay. So maximum score of the GCS is the P is the 0 and P minimum score is the minus 2. Okay. So we are here doing the GCS plus P. So 15 plus 0, maximum score of the GCS P is same like GCS, that is the 15. Okay. If they are asking the minimum score of the GCSP, okay, what is the minimum score of the GCSP? So P's minimum score is like minus 2. Okay. So we have to do the minus. Okay. What is our minimum GCSP score? Let me take one pen here. Okay. See, our Glasgow, comma, scale minimum score is 3. Okay. So we are doing the P here. GCSP minimum score is plus GCSP P's minimum score is minus 2. So 3 plus into minus 2 is 1. The minimum GCSP score is 1. Okay. Very, very important. So if the examiner is asking, don't confuse. If the examiner is asking maximum GCS score, maximum GCS score is 15. Minimum GCS score is 3. If the examiner is asking the maximum GCSP score, same 15. If the examiner is asking minimum GCSP score, the answer goes 3. Sorry, answer goes 1. Yeah, okay. Minimum GCSP score is the 1. You have to remember this one, very important. Okay. So we have discussed each and every point on the GCS. Okay. So let me go for the interpretation of the GCS. What is the score normal? Which score is abnormal? Which, at what point of the time we have to put the patient on the ventilator? I will explain here. Okay. If the score, total score is coming more than 13, means 13 to 15 is patient is conscious, patient is normal, patient is better responsive. Okay. If the score is coming like this, 9 to 12, the patient is in semi-conscious. Okay. So we'll not allow anything orally. You have to remember, because highest chance of aspiration in semi-conscious patient. If you are allowing anything orally means the patient should be completely conscious. If the Glasgow coma scale coming between the 9 to 12 means we will not allow anything orally to the patient. So we have to put the patient on NPO, nil per oral state. Okay. If the Glasgow coma scale is going less than 8 means that is what the brain is about to die. So the patient is in the coma state. Okay. So when the Glasgow coma scale goes less than 8 score means 3 to 8 is very dangerous. At this point of time, we have to put the patient on the ventilator. We will intubate the patient based on the need of the patient after assessing the Malan-Patti score. Okay, very important. So this is what all we have discussed on the Glasgow Coma scale. Here is our last point of the today's session, that is AVPU score. So I told the Glasgow Coma scale having the, so lot of the components having the 3 components. Among those, each components having the many subcomponents. So because of that, we are unable to assess in the emergency room. So AVPU score neurologist found for easy assessment and quick assessment of the neurological function and level of consciousness in the emergency room. So in the emergency room, we will not assess the Glasgow coma scale. We will not assess in the emergency room. In the emergency room, we will assess the AVPU score. Okay. What is A stands for? A stands for alert. What is V stands for? V stands for verbal response. P stands for pain response. U stands for unresponsive. Based on this one, we will plan our further treatment. Okay, this is the what AVP score. So we will use this scale in the emergency department and GCS in the routine use. Okay. So I think this video is very much helpful for you. I have explained everything on the Glasgow Coma scale, Glasgow Coma scale P, okay, and AVPU scale. So please note the things carefully. And so I have explained the very important question which arises like that. Maybe the question pattern may changes and the values may alternate, but the pattern comes like this. Patient is not responsive, not opening eye to opening painful stimuli like this only. So you have to write in exam like this. First you have to write in your exam like this. What tricks I am telling to solve the GCS score. So for I response you will write ESPN. For verbal response, our country win. And for S, motor response, can't live without fan. Okay, very important. Just tick mark there. What they have given in the question? They given in the question like patient is response to painful stimulus. Yes, here is the 4, 3, 2. 2 score you have to mention here. Okay, 2 score. And for verbal, what he given is using the inappropriate words means here it comes maximum score 5, 4, and it's the 3. Okay, 3. Okay, and in motor response he is telling obeying the command means the maximum score is 6, so it comes the 6. Okay, you have to add this all thing. For our GCS score it comes like 11. If the examiner is asking GCSP, so what's the idea what he given in the question like the both peoples are responsive, one people is unresponsive, one people is responsive like this. Based on that you have to substitute or remove those scorings from the GCS to get the GCS P score. This is the simplest way how you will study these things. So thanks for watching the video completely. If you found and the video informative, please share the video with your friends and hit the subscribe button to get more videos for your competitive exam purpose. Okay, thank you so much.